Hi everybody, this is Dr. Rakesh Shah from Atlanta, Georgia, and welcome to my medical talk. It's called Med Talk, medical knowledge for everybody. Today I'm going to talk about a very important topic. It's called obstructive sleep apnea. We call it OSA, obstructive sleep apnea. Do you or anybody else that you know ever snore? Like when they sleep, there's loud snoring, okay? And this typically starts after age 30. Now sometimes we think snoring is a sign of a good sleep. Yeah, it's a deep sleep that you're sleeping very good, but sometimes it can be a message for a very serious medical condition. It's called OSA, obstructive sleep apnea. You don't die because of it, but there's a lot of side effect because of it. Now what is OSA? Obstructive sleep apnea. That means there is an obstruction. It happens during the sleep, and apnea means stop breathing. So I'm sure if you watch a lot of people sleeping, especially after 30, you will see that they're snoring loud and suddenly they stop breathing and suddenly they wake up. They may not be completely awake, but then they kind of like this and then they go back to sleep again. Okay, so what happens exactly? See, how do you breathe? Nose and then mouth. Okay, so air goes inside, and this area is very critical in the sense that when you're young, there is airway, windpipe, we call it windpipe. The tongue is right here. So normally when you sleep like this, when you're young, the tongue doesn't fall back. The muscle tone keeps it like away from the windpipe. But as you grow older, if you're obese, like heavyweight, and typically male patient people, when you sleep, the airway here, the windpipe gets blocked, and the air going down the lung stops, and suddenly brain gets the message that hey, there is no air. So suddenly you arouse like this. So that is called obstructive sleep apnea, and it happens to almost 20 to 30% of the male and 10% of the female. Now how do you know that you have it? Obviously you will be snoring loud at the night. So if you're married, your wife probably will tell that hey, this guy won't let me sleep. Okay, and you don't have any control over it. Unfortunately, it's not like you're doing it deliberately. It just happens because the airway here is so loose that it blocks the whole path. Okay, and then because you are not able to sleep in the night, during the daytime you are sleepy. You may not realize that you are sleepy, but you are. So then there is the irritability, poor concentration, and the other important thing is you can develop a blood pressure, then heart problem, and sometimes diabetes and other stuff. So there are secondary problem that can happen with it. And another most important problem that can happen with it is that increased incidence of car accident, because you're sleepy during the daytime and you don't even know. So you can have a lot of accidents. Plus if you're working in the heavy machinery, you can have a lot of accidents there. So very serious condition if you don't pay attention to it. So if you are, or if you know somebody who is snoring loudly in the night, make sure you get him checked out for this obstructive sleep apnea. Now what are the risk factors? Obviously, as I said, that being a male, hereditary or family history also plays a role. Then if you're obese, heavyweight, it can increase the chances. And if you are pregnant, it can increase your chance of sleep apnea, maybe temporarily. Then if you have other problem, then it can increase the chance. If you are smoking, if you are consuming alcohol, if you are taking some narcotic pain medications, those are the things that increase the chance of sleep apnea. Then you're having a diabetes, stroke, kidney diseases, those also increases your chance of having sleep apnea. So how do you know that you have sleep apnea? I already told you that symptoms, like as a common man, you can watch out for those things, that somebody is snoring loudly at the night, then suddenly he stops breathing for a few seconds and suddenly he arouses and then he goes back to sleep. So these are the typical of sleep apnea. Then daytime he is irritable. Then if you go to a doctor, they can examine your airway and they can see that you might have big tonsils, big adenoids, or this area may be too small, the mandible may be too small, or you can have high blood pressure. So if you are having high blood pressure, one of the reason could be your sleep apnea. Okay, so these are the signs that we see in the patients. Then we examine the mouth and see what's going on inside. Then how do you diagnose? Okay, history obviously is important, but then we do the testing. There are two type of testing that you can do. We call is a polysomnogram. Poly means we check a lot of things, somno means during the sleep, and gram means a graph. So you go to the hospital, or we call a sleep lab. So you go to the sleep lab, you stay there for the whole night, and they put an EEG on your brain, so they will check when you're having a REM sleep, that is rapid eye movement sleep. That is a sleep when you basically dream. REM sleep, your eyes are moving, so actually they check for the eye movement. And this sleep apnea actually happens during the REM sleep. Why? Because during the REM, that is a rapid eye movement sleep, you are dreaming, and it is a natural mechanism. When you are dreaming, you are actually paralyzed, your muscles don't move. Because think about it, if you are having a wild dream and if your muscle is active, then you can actually act out your dream. So that's a kind of a God's way of not making sure that, means making sure that you don't act out your dream. But what happens that during this REM sleep, this sleep apnea becomes severe because everything is paralyzed. So this part is also paralyzed, and it blocks the way. So during the polysomnogram, we checked for that, and then we checked for your blood pressure and EKG and other stuff while you're doing those things, and then muscle movement and muscle tones and everything. But basically the whole idea is to watch you over the period of whole night and see how many times you stop breathing, how many times you become like this. And then if you are doing it more than 5 times per hour, then that's a serious condition. So then you get treated. If it is more than 15, that's pretty bad. If it is more than 30, you have to have a treatment. Okay, so that's how you diagnose. And then some people can go to the hospital for that. So there is a in-home testing also, but I would not recommend in-home. If you can do it in the hospital, but it's not always possible. And then obviously you can check for blood pressure and other stuff. So that's how you diagnose sleep apnea. Then how do you treat sleep apnea? So there are medications, there are surgery, and there are medical devices. You can go back to my talk on the medical devices. So before you use any medical device, make sure you watch that video. But the main treatment is, we call it the CPAP, that is a continuous positive airway pressure. Okay, so it's like a big mask. You can have a mask that fits on the nose, or mask that fits on the face, or mask that goes in just nasal cannula kind of a thing. So basically what it does, it forces the air into your airway in the windpipe. So it keeps it open. So that's the best way to treat the sleep apnea. We call it CPAP, CPEAP, continuous positive airway pressure. So you keep pushing the air. But sometimes it's not possible because people don't like it. There's a machine is so cumbersome, and you have to wear it every night, and your wife may not like it, your husband may not like it because you're wearing that machine. Okay, you know what I'm talking about. So then, but that's the best way to take care of this chronic problem. Now if you don't like it, then there are some devices that you can put in the mouth. Basically, because this is blocked, what you do is you bring this jaw forward. So there is a mandibular advancement devices that you have to go to the dentist, and they will take the measurement, and they have to make custom made devices to bring it forward to wear all night. Then there is a tongue suction devices where when tongue actually falls back, so you can bring it back. You can look up online and you can see there are so many devices available. So you can bring it back, and that's how you can keep your airway pattern. So either you wear CPAP machine every night, or you have to carry it wherever you go, or you have this mandible advancement splints, or you can have tongue suction devices, or you can have another device called hypoglossal nerve stimulation. So that's another medical device that you implant in your body, and it stimulates one of the nerves that controls this area. Okay, you don't have to go in much detail, but basically there are some devices that can help with that. Okay, and then there are surgeries. If you have big tonsils, big adenoids and things like that, it can be taken care of with the surgeries, but it has not much role. And then there are medications, theophylline and mirtazapine, and there are so many medications that you can take to kind of keep you airway open or keep your brain stimulating to breathe. And then there are medications to take during the daytime if you're sleeping too much. Okay, but those don't cure the problem itself. Okay, these are just adjuvant medication, we call it, to help with the breathing and with the daytime sleepiness. So that's in nutshell. But basically, what is sleep apnea? It is obstruction of the airway. How do you cure it? You cannot cure it. It's an incurable condition, but you can wear a CPAP machine and it can keep the airway open. Why it is important? Because it can cause a lot of secondary problem, including high blood pressure, sometimes diabetes, heart problem, and a lot of other stuff. So that is the reason you really need to take care of the sleep apnea. Okay, so that's called OSA, obstructive sleep apnea. Thank you for watching. This is my Mad Talk. This is Dr. Rakesh Shah from Atlanta, Georgia. Thank you.